Hi friends, all of you who are watching this video. I am Dr. Nazima Sharif. I am a practicing dermatologist at Radiant Skin Clinic in Bangalore. Today, I will just be discussing and giving you relevant information, sufficient information on a condition called vitiligo. Most people know it as leukoderma. Most people do not even like to take its name. This vitiligo or leukoderma is nothing but a loss of pigment which is either inherited or it is acquired. In many situations, it is also associated with other conditions like your thyroid problem, diabetes, certain drug intakes. Now, vitiligo is worldwide. It affects both sexes, and worldwide almost 1 to 2% of the population is affected by it, so you are not alone. But vitiligo unfortunately has a lot of psychological distress. It has a lot of problems with career prospects, marriage proposals and prospects, and also a very bad social stigma even now in Asian countries. Now, vitiligo can be divided for your convenience to understand into two types. One, what we call the localized, which is a vitiligo restricted to one place. So, it could be a couple of patches or one patch in one area. The other type of localized vitiligo is segmental. As the name says, it is vitiligo which runs along a segment, but you do not find it elsewhere. The second type is a generalized form where the patches or the loss of pigment patches can be visible anywhere on the body, multiple such patches. That's one type. The second generalized form is what we call the centroacral or centrofacial acral vitiligo. To make it easy for you to understand, it is vitiligo on the face, the lips, the fingertips, the palms, toes and soles. So, this is what we also call the lip tip variety. Let's remember it like that. The last rare form is when the vitiligo affects the whole body, called the universal vitiligo, leaving behind a few patches of normal skin. So, I am sure most of you would have seen varieties of these things when in the society. Now, before I tell you anything more about the treatment for vitiligo, I would like to say one thing. At one time, vitiligo had hardly any treatments available. It was a desperate situation. People would try to camouflage as much as they could, but still the stigma would remain. Today, we have a lot of new information, a lot of new technology, newer therapies which help us to get a decent enough pigmentation in many cases. Though the prognosis of how the vitiligo progresses as a disease or a response to therapy is unpredictable, we can still say that with a lot of new treatments that your dermatologist is going to help you with, you may find the outcome is way better than what you thought it would be. But here, we find sometimes the lip tip variety that I told you about, that the lips and the tips and the palms and soles may not respond adequately, mostly due to the lack of hair follicles there. And even vitiligo, which is universal, it is not going to be easy to repigment such a large area of the body. For that, we do something else which I will tell you about a little later. Now, before the vitiligo treatment is started, your doctor may ask you to undergo some blood test. You may wonder why. One white patch, why a blood test? Yes, it's necessary. We need to know whether you have any other problems associated, especially autoimmune disorders like diabetes and thyroid, because vitiligo is also an autoimmune disorder where your pigment cells are destroyed by your own immune defense mechanism for unknown reasons. So, once autoimmune disorders are ruled out, your doctor will want to get your blood counts, they will want to check your liver, your kidney, etc., to start off the treatment which has to be customized. Now, as far as the treatment is concerned, one is a topical treatment, that is where your doctor is going to give you certain medications to apply. They can be in the form of creams, ointments, lotions, gels. The commonest one that we give are topical corticosteroids, which give a scare to a lot of people, but please let your doctor handle this The doctor is the one who is going to check for any side effects or overuse of these treatments. But yes, these are a very useful tool for us to help control vitiligo, and we give topical steroids for about 8 weeks, and if there is no improvement, we switch over to some other medication. The second medication is what is called immunomodulatory medications. These are steroid sparing, and like for example pimecrolimus, tacrolimus, which may sound new to you, but we use these drugs specially in children or in cases where we can't apply the steroids, or we use it for patches on the face and the neck. So tacrolimus is safe. It may give a little burning sensation for about a couple of minutes after you apply, which again is nothing to worry about. Certain times we also give the steroids in the form of injections. Now those are not given to all the patches. Your doctor will help you decide, and they will be the ones to decide which patches are the ones that need an intralesional steroid. Other topical types of treatments are, we have light sensitive medications. These when applied in the form of lotions or ointments and then exposed to radiation in the form of actual sunlight or in the form of a UVA chamber or handheld UVA devices, they help to stimulate more pigment to form. Similarly, we have other light devices or radiation devices, for example UVB, which you can find as UVB chambers in a hospital that you can attend, you can visit twice a week, thrice a week for therapy, and also a laser called excimer laser, which has very specific wavelength of the UVB, which repigments skin. So basically these are a lot of the topical treatments that we have. We also have certain newer molecules in the market. You may not have heard of it, but I will just put in a word. They are called JAK inhibitors, available as oral and topical, which we find are giving us very promising results in vitiligo. Now leaving the topical treatment, we can now come to the systemic treatment. In the systemic treatment, if your vitiligo is new, if you are having active vitiligo, the patch is expanding, or you have a vitiligo which is spreading rapidly in newer places, our treatment is oral steroid therapy. Oral steroids are given under supervision by your doctor, and this can be given as pulse therapy, so you don't need to take it every day, you can take it 2 days a week. Along with this, we also have oral light sensitive drugs. As I spoke to you about light sensitive ointments and lotions, we have similar things in capsule forms. So these are to be ingested and a couple of hours later exposed to either the sun or the UVA light. The third type are what are called antimetabolites like methotrexate, immunosuppressants, because as I told you, this is an autoimmune problem. Immunosuppressants like cyclosporin will also help the skin to repigment. The newer molecule, what I said again, that's a JAK inhibitor, also comes in an oral form, and it has shown very promising results. Sometimes the vitiligo may not respond to all these things, but if the vitiligo is stable, it has not changed and it's on the lips, then we can go in for surgical procedures like skin grafting. One is a simple skin graft. Skin is taken out from your inner thigh and it is transferred onto your vitiligo patch. Sometimes the skin is not just taken out with a blade, but we create a blister on the skin on your thigh, which brings out a much thinner layer of the skin, which is then transferred to the patch that you need. Lastly, we have what is called a melanocyte transfer, where your pigment cells are extracted from a biopsy specimen and they are applied to your vitiligo patch. So this is very useful in vitiligo, especially for the lips and for young people who are very conscious about it, or for certain patches which are exposed and which have absolutely not responded. So I hope today that I have given you an overall and brief idea about vitiligo and its treatment. To end it all, I would like to give you a word of caution. Please do not self-medicate. Please do not self-do procedures. Please meet your dermatologist and take their guidance and help to help you get rid of or to improve your condition. Thank you.
For more such videos, visit or log into DermaVidya.com.